it. It is called the heart and the circulation one. So let's start. The hair and circulation one. A shortness of breath. Shortness of breath or breathless is dyspnea. At first, this is caused by exertion, physical activity such as climbing stairs, but in severe cases it may be present even at birth. A patient who is breathless when lying flat or tonia, for example in bed, will tend to sleep raised up on two or more pillows. The abbreviations ASLBOE stand for shortness of breath on exercise or on exertion or on effort. The patient can say, I got terribly short of breath climbing stairs. And the doctor is gonna ask, how many pillows do you sleep on? B. Her rhyme. The normal resting heart rate is 65 to 75 beats per minute. In adults, it may be as low as 40 beats per minute. In strong athletic activity, the heart rate can go as high as 200 minutes. The heart rate might be regular or irregular in a irregular rate, arrhythmia. There may be early beats, which interrupts the regular rhythms, premature beats, or the rhythms maybe with respiration, or it may be completely irregular as defibrillation when patients are aware of irregularity. They describe the symptoms as palpitations. Case 4. A 22 years old student was admitted to hospital with a long history of heart problems. She has been increasing tired with shortness of breath on exertion, orthonia, and palpitations. A mitral valve replacement had been carried out 2 years previously, and this had stabilized the symptoms of heart failure, who was followed by episodic attacks on atrial fibrillation, which has been particularly severe for the 6 months before admission. C. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output. The amount of blood pumped by the heart each minute for the body needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral edema, swelling beginning in the feet and ankles. This is known as perineal edema. If when a finger is pushed into the swelling, it causes small depression or bleed. So we got the aorta, the pulmonary artery, the pulmonary veins, the mitral valve, the septum, and the tricuspid valve. So it's time to translate. Okay, this unit is called el corazón y la circulación uno. Falta de aire. La falta de aire o disnea es la dificultad para respirar. Al principio esto se debe al esfuerzo, actividad física como subir escaleras, o en casos graves puede estar presente incluso en reposo. Un paciente que tiene dificultad para respirar cuando está acostado boca arriba, por ejemplo, en la cama, tenderá a dormir incorporando sobre dos o más almohadas. La abreviatura significa SOCOE, significa falta de aire durante el ejercicio o durante el esfuerzo. Los pacientes dicen, me falta mucho el aire al subir las escaleras. Los médicos pueden preguntar, ¿con cuántas almohadas duermes? B. Ritmo cardíaco. La frecuencia cardíaca normal en reposo es de 65 a 75 latidos por minuto. En los atletas puede ser tan baja como 40 latidos por minuto. En la actividad atlética extrema, la frecuencia cardíaca puede llegar a ser tan alta como 200 latidos por minuto. El ritmo cardíaco puede ser regular o irregular. En un ritmo irregular, arritmia, puede haber latidos prematuros que interrumpen el ritmo regular. Que interrumpen el ritmo regular. Extrasístoles, o el ritmo puede variar con la respiración o puede ser completamente irregular como la fibrilación. Cuando los pacientes son conscientes de la irregularidad, describen el síntoma como palpitaciones. Caso 4. Un estudiante de 22 años ingresó al hospital con un largo historial de problemas cardíacos. Había estado cada vez más cansada, con dificultad para respirar al hacer esfuerzo, ortopnea y palpitaciones. Se le había realizado un reemplazo de la válvula mitral 3 años antes, lo que había estabilizado los síntomas de insuficiencia cardíaca, pero fue seguido por episodios ataques de fibrilación auricular, que habían sido particularmente graves durante los 6 meses anteriores al ingreso. Insuficiencia cardíaca. La insuficiencia cardíaca se produce cuando el corazón no puede mantener un gasto cardíaco suficiente, es decir, la cantidad de sangre que bombea el corazón cada minuto para las necesidades del cuerpo puede afectar al lado izquierdo del corazón, el lado derecho o ambos. En la insuficiencia cardíaca izquierda, el síntoma principal es la dificultad para respirar. Los síntomas de la insuficiencia cardíaca derecha incluyen edema periférico, hinchazón, que comienza en los pies y los tobillos. Esto se conoce como edema con fovea si al presionar con un dedo la hinchazón se produce una pequeña presión u hoyo. Mira, aquí tenemos algunas partes del corazón. Tenemos la aorta, la válvula tricúspide, la arteria pulmonar, las venas pulmonares, la válvula mitral y el tabique. Okay, so now we're gonna be reading the exercises. Okay, we got 22.1. Complete the conversation based on the case history in B opposite. Doctors, when seems to be the problem? Patients, Ivan's getting palpitations. Doctor, how long have you had them? Patients, for about 6 months. But I have had problems for years with tiredness and shortness of breath. In the end, I can walk more than 100 meters without having to stop. I have to sleep on three pillows. I have a mattress bed, both replacements years ago, and that improved things for a while. 22.2. Make words combination using a word from each pause. Two words can be used twice. Look at B and C opposite to help you. We got address, atrial fibrillation, cardiac outflow, cardiac failure, heart failure, on effort, beating, beating of edema, premature beats. Okay, 22.3. Write the words a patient will use to describe the symptoms below. Look at A, B, and C opposite to help you. Dyspnea is shortness of breath. Arrhythmia is palpitations. Obtonia is breathless with lean flat. Oedema is swelling. And now we got 22.4. Complete the case report. Look at A, B, and C opposite to help you. Case 13. A 60-year-old woman attended her GP surgery complaining of breathlessness of exertion. This has been increasing over the previous 8 months until it was producing problems at around 500 meters walking on the level. There was no history of chest pain. She had several episodes of fast palpitation which lasted like 20 to minutes and were associated with some shortness of breath. She has noticed some swelling of her ankle by the end of the day. This disappeared overnight. Okay, this is all for this chapter. See you in the next chapter. Bye.